Hello, I'm Dr. Robert LaLouche, board-certified OBGYN physician with over 30 years of clinical experience. And today I'm going to give you some routine discharge instructions for a cesarean section. So you're certainly going to get this from your provider, some of the information, but you can refer back to this information. You'll also be sure you have some written information and guidelines, again, that'll be tailored to your circumstance. But here's a refresher for you. So it's a little bit harder to recover after a cesarean section from just a vaginal delivery. And hopefully you've got some pain medicines that'll help you with some comfort. We generally recommend that you avoid baths, that you take showers until your follow-up visit, and that you avoid heavy lifting until you've been seen by your physician and get the clearance. So how much can you lift? Well, I normally say if it takes 2 hands to lift, too heavy, okay? So of course the baby takes 2 hands, but that's not for weight, that's because of delicacy. So if you want to pick up a glass, one thing that normally just takes 1 hand to pick up, then that's okay. But heavy things can put a lot of undue strain and interfere with healing and put you at risk, so don't do that. Also, don't recommend driving for about 2 weeks. That can vary depending on your own risk factors and your clinical circumstance, whether or not you have diabetes, whether or not you have high blood pressure, other circumstances, but that's a good rule of thumb. And you can be a passenger, and you should use soap and water on your incision unless you've gotten different instructions. You might have suture material, you might have staples. If you've got staples, generally they'll have you come back to get those out 4 to 10 days after. Again, depending on your body and your circumstances, the instructions may vary, but try to use soap and water and keep it clean. If you notice a little bit of leaking, try to cover it up and keep it dry. But if it persists, that's something that you need to give a phone call to your physician for. Also, if you get a fever, that might be a sign of an infection. So you're supposed to be monitoring your temperature, and some fevers after C-sections can happen on the 3rd or 4th day, or even all the way to the 10th day or later. So you want to monitor that and try and get as much rest as you can. Of course, you've got a baby to take care of, and that makes it hard to be totally rested, but be sure you get your partner and your whole support team, your family to help out so that you're not doing too much extra work besides take care of your child and take care of your own self. You also want to watch for difficulty breathing, shortness of breath. You want to watch for swelling in your legs. Now, you're going to have some swelling on both legs usually. Most women get a little bit more when they go home, especially if you had some blood pressure issues. But you want to look for one-sided swelling that's dramatically different than the other, like your ankle as big as your knee, something like that. If you're not sure, ask questions. You've got your support team available there for you. That's what they're there for, so I encourage you to ask questions. Congratulations on your pregnancy. I hope you found this helpful. Thank you.